Good afternoon, professors. My name is朱玉鹏from the First Hospital of Jilin University. I'm going to share a story about 10 minutes brainstorming outpatient. Our patient was a middle-aged male with a complaint of abdominal bloating for 2 months. He used to get HBV infect. Before we met, he only underwent a CT. Multiple low attenuation could be observed on CT. They had a rim-like enhancement in artery phase and hypo-enhancement in both portal vein and delayed phase. According to CT, they must be malignant. Are they primary or metastasis or some other malignancies? And he underwent an ultrasound. Multiple hypoechoic lesions could be observed on ultrasound with strong blood vessels. And he underwent a CUS. All the tumor began to enhance at the 13th second and decrease at the 23rd second after intravenous injection of 1.8 milliliter of Sonovil. All the lesions had a hypo enhancement in both portal vein phase and delayed phase. Let's summarize the features of image. Multiple hypoechoic nodular with mass effect and well-defined margin in liver. Abundant blood supply. Showing washing in and washing out in CUS, homogeneous hyper-enhancement in artery phase and wash out in early portal vein phase. Are they benign or malignant? Wash in and wash out, they must be malignant. Early clearance may imply that they were not arranged from hepatocyte. Are they intrahepatic cholangiocarcinoma or metastasis or some other rare malignancies? How to get away with illusions? Most ICC is hypoechoic in ultrasound with no well-defined margin due to its infiltrative growth, and it also causes cholangiostasis nearby. The enhancement pattern of ICC is rim-like with non-enhanced center or hypo-enhancement in artery phase usually. How about metastasis? Most metastasis is multiple hypoechoic nodular with dark halo. Large nodule may have a neurotic area inside. The enhancement pattern of metastasis is related to the original tumor. Rim-like enhancement in artery phase and clearance in early portal vein phase is most common. Maybe there are some rare malignancies. Are there hepatic angiosarcoma? Angiosarcoma is usually alveolate or solid and mixed cystic. Hepatic hemangioendothelioma often has a rim-like enhancement. Hepatoblastoma often happen to children. How about hepatic lymphoma? When we talk about hepatic lymphoma, nodules of this case were similar to lymphodynectasis of lymphoma with fence-like pattern inside. We also could observe the hilum-like hyperechoic pattern in nodules. Pathologically, hepatic lymphoma may have a nodular or diffuse growth pattern. In the nodular form, the lymphoma cell have a destructive growth pattern without detectable portal tracts within. In conclusion, this patient may get a hepatic lymphoma. We advise him to go to the medical team of lymphoma to complete relative tests. Some important evidence were observed or found in laboratory tests. LDH, beta-2 microglobin, and EB virus DNA increased. Finally, we did a biopsy on him. The result is diffuse large B-cell lymphoma. And then he underwent a PET-CT. After 6 sessions of R-CHOP chemical therapy, he got a complete release. And he underwent a CUS again. Those nodules were replaced by the hypoechoic area with no mass effect. And they had a hypoenhancement in all phases. Dr. Lu described 24 cases of hepatolymphoma in their article, in which most of lesions were homogeneous hypoechoic and either round or oval with well-defined margin. Strong color flow signals were detected on CDFI. Our case responded to their description. In the article of Professor Trunker, which contained 38 cases of hepatic lymphoma, hyper-iso-hypo-enhancement could be observed in outward phase. Most nodules showed hypo-enhancement in portal phase, and all of them showed hypo-enhancement in delayed phase. CUS could distinguish between benign and malignant, but could not confirm hepatolymphoma. Here is the table in Trunker's article. Finally, we should be aware of hepatolymphoma when patients get multiple nodular in liver, which are similar to lymphadenectasis of lymphoma in details. The enhancement pattern of hepatolymphoma is washing in and washing out. Homogeneous hyperenhancement could be observed in outward phase, and nodules wash out in early portal vein phase. Some important detail could be observed in ultrasound. Thank you.
Thank you, Dr. Zhu Yupen, for your presentation. Now we'd like to have Dr. Li Fan to comment and ask questions on the case.
Dr. Zhu Yupen shared us a very wonderful case of liver lymphoma. The images are always good quality. And what is worth mentioning is that I saw there is a picture that you used the high frequency probe to detect the tumor, and you find the similarity of the tumor with the enlarged lymph node. So you do this scan or from the literature, this picture?
The lymph node, the picture of lymph node is from the article on internet.
Not you did. Oh, okay, I see. So I think this is a really good picture. And what I want to ask is that, is this a primary hepatic lymphoma or a secondary hepatic lymphoma?
According to his PET-CT, it's a primary hepatic lymphoma because it's only the tumor was only found in liver, not otherwhere. And during his treatment, there is no other lymphoma was found in other organs.
Okay, thank you.